Hello.
Baru masuk ke?
Dah okey ke? Dengar tak?
Oh, dengar. Tadi
Okey.
tak dengar.
Okey, kita start. Alright, Assalamualaikum and good morning to all audience and viewer from Masa University Facebook page and Masa University YouTube channel. Before we begin, allow us to introduce our speaker today, Dr. Brad Ng. But first, before we start our session, our guest has requested to play these two short videos before he starts. Let's take a look.
Hello. That's so rad. Look out the window. That's me.
You're gonna say it was me.
No, I wasn't gonna say that.
All right, devil's advocate. Let's say it was me. But you know that I'm a talking cat. There's no such thing. Everything I say is really you.
It's true, buddy. It's all you.
What? Come on, Jer. You know that.
Your pets are spot on, Jerry.
I kind of suspected that. But if there's me, regular me standing here, the me who's talking now, and I want to be good, then there's you, and you trying to make me be something else. Am I good?
No. You're bad.
She's wrong. You're a good boy. They're both wrong. You are what you are.
That's it.
All right, before we begin, allow us to introduce our speaker today, Dr. Brad Ng, which is graduated in psychiatry major in University Malaya in 2016 and graduated medicines from IMU on 2005. Without further ado, I would like to welcome Dr. Brad Ng to deliver his interesting topic today, entitled Hearing Voices. Am I Mad? All right, Doctor, the floor is yours.
Thank you, Hafiz. Thank you for inviting me also for delivery the speech to everyone. Actually, this also is my duty as a doctor to do a health awareness because mental health awareness are rather lacking in the community. So the question is, hearing voices, am I mad? Actually, not necessarily. Yeah. Can I go to the next slide? First, we go to the definitions. What is meant by hearing voices, and the technical term is called hallucination, auditory hallucination, because it's is actually hear voices. The simple definition is you hear the voices, but actually there's no stimuli. There is actually no voices or no noises or anything. Yeah, so that's called auditory hallucination, because hallucination can have a smell. You can have smell. You can have touch. You can be seen. It's called visual hallucination. But the most common hallucination is actually auditory hallucination. So hallucination mean that it's from your sensation. You have the sensation, but there is no stimuli. Yeah. Next. It's quite similar with tinnitus. Tinnitus is actually you're having some issue with your ears. It's actually noises. You hear noises, right? Next slide. The noises can be hissing sounds, ringing sound, whistling sound, but actually no human voices. Clicking sounds is something like after your ear, after you have swimming, mandi laut ke apa, so that the water have entered your ear. So you hear these type of noises on and off. Next slide. Okay, it's very common. You can say that 1 or 2 out of 10 people here, you can you have experienced tinnitus before, and 3%, up to 3%, it didn't resolve spontaneously. It will affect life. Next slide. is this is the structure of the ear. So it's actually some happen to the siput there, the siput inside there goes one the round circle things that's inside your ear. That areas which control your balance and also your healings. That areas was having some defect, minor defect. Yeah, if severely defect mean you can't hear properly, you lost hearing. So it's some minor defect. So you start to have tinnitus. Right. Next slide. Okay, now we go back to the auditory hallucination, which is different. You hear voices. Yeah, 4 to 12%. Yeah, is is normal. Is happen in the non-mental health, non what to say, not the patient lah. 4 to 12% among mean depend on where you do the survey, in the city, in the kampong, or in the city, rather a bit more common. The 4 to 12% among those who are they are not a patient, they are not a psychiatric patient. So it's a normal life experience. They have experienced before, perhaps a few weeks or something like that. So it can be normal. So it can be induced. you tak sakit, you tak sakit, you are not sick, but you can induce it. Later I will elaborate on that. Or of course, as what you think that is caused by some of the major mental illness, or it can actually caused by brain tumor. Yeah. So if you suddenly hear voices without any symptom, so perhaps you should go and do some brain scan. But actually, in all the psychiatry setting, first time you ever hear voices, yeah, never hear voices. First time you ever hear voices, so usually we'll do some brain scan to at least, to rule out it's not a brain tumor. But if you hear voices accompanied with seizure, sawan, epilepsy, penyakit sawan, and then it's called by epilepsy lah. It's around 20% chance for the patient who have epilepsy to have a seizure. And musical hallucination, I also will elaborate on it. Okay, next slide. Okay, this is a normal experience. It's a normal experience. Hypnagogic hallucination and hypnopompic. And the word sounds very interesting, isn't it? Hypnagogic is something like wake up. Upon wake up, you're not fully alert that time. You hear some voices. Usually it's very simple. Where it's like calling your name, or whistles, or how to say, babysat, very low volume. You can't hear clearly. It's like something like that. Hypnopompic, hypnagogic is about to sleep. Hypnopompic is just wake up. Yeah, one is about to sleep. You're a bit already sleepy. You're already sleepy, not very alert. You want to sleep. You're going to sleep. Yeah? And one is you wake up, but not fully alert yet. It's still a bit blur at the time. It's a very common experience, and it's normal experience. It's happened in a normal community. Induced, so for here, we want to tell you, do not even try once. It's nothing to, if you want to try, you can try bungee jumping, Do not try any illicit drugs, illegal drugs, because forever you can remember. It will implant in your memory. The more you try, the more you remember it. All right. So when you are sick, you're stressed, you are down, you tend to remember it. So it's like amphetamine, which we call it ecstasies, and methamphetamine, which calls ice, and cannabis. So usually in high dose or long-term use, will induce the voices. Alcohol. Some people, they cannot digest alcohol so well, so they tend to hear voices. Yeah. Complete darkness, we call, is a very common research have been done like more than 50 years ago in some country, or I think Europe or what. There is a room, there are complete darkness, complete no noises, no voices. Lock you inside the complete darkness and no noises room, completely no stimuli. Less than 5 minutes, you can start to see figures and hear voices. Yeah. Intense emotion, certain people will have. When they have intense emotion, very angry, very sad, they can also hear voices transiently, temporarily. Yeah? Next slide. It doesn't mean they have a psychiatric illness as well. Musical hallucination, as its name implies, is actually they hear music. They hear music. I can't see from here. Maybe I have. It affects about, especially those who are hearing no hearing impairment. They are mute and deaf. Among them, 2% of them especially, they tend to hear music. But actually, it's very common for those who are deaf. They hear voices, but they are not psychiatrically ill. Yeah. So some people that always hear music, like hearing the ringtones, they're using the headphones so much, and they play music all the time. They tend to hear sometimes on and off. They can hear some music. So there is a case happened before. The musical composer, when they're hearing music during wake up time or about the sleep time, they hear the music and they compose from it. And actually, they compose the music from it. Yeah. Okay. Next slide. And it's normal as well. It's a normal experience. Yeah. Okay. Next slide. I mean, the word is a bit small. It's also a musical hallucination. Okay. Is the musical hallucination can be normal and also can be induced by medications. Yeah. Okay. Next slide. We go to the one that you are waiting for is the major mental illness. So as far as we know, the first one, the diagnosis is what we know, schizophrenia. Schizophrenia that you tend to see from the roadside. Yeah. If you drive along KL and Chowkit, sometimes on the highway you will see some people that are really dirty, they walk along the road, but they didn't disturb people. They're talking to himself, So talking to himself, that's the one that play on the video before the talk. Before I start talking, that the one play in the video, there tends to be a schizophrenia. I mean the schizophrenia diagnosis. I will elaborate a bit. And the mood disorder, the one also, that one can happen in many people's. Yeah, depressions and bipolar disorder. Yeah, and dementia. Nyanyuk boleh dengar suara juga. So next slide. Now we talk about schizophrenia. The diagnosis, I mean the clear criteria to say is schizophrenia, it must be 6 months. Less than 6 months, we call it a different term, but it's also towards the schizophrenia because belum 6 months you already bring to the hospital. So maybe we don't call it schizophrenia yet lah. Schizophrenia must be 6 months. Unwell, I mean dia nampak pelik lah. Sometimes talk to himself, but it's still okay. 1 month full blown, they cannot work completely. 1 month, they cannot work, they cannot do anything. So hallucination, besides hallucination, at least and other symptoms can be called delusion. Delusion means something like sakwasanka, but actually no such thing. But he's very strongly believes it's happened. It can be like, someone want to harm you, or there's aliens coming to the earth, or for example, or disorganized, yeah, with something like wandering around not purposely, and it's usually affect daily life, work, social life, for example. It's related with a chemical, brain chemical which is called dopamine, which we call it the excitement or reward chemical in your brain. After you makan, lepas you hear the seminar, you go for KFC, and your dopamine will firing in your brain. Oh, you feel excited, you have some reward. Or during your birthday, your friends or your lecturer giving you a gift, you have this dopamine increase in your brain. Yeah. So we found that we block the dopamine firing in your brain, tends to cause the symptom of schizophrenia resolve. Yeah. Next slide. Okay, this is the brain from some high technology. For the previous 50 years ago, we don't have this type of scan. We don't have, but now we have this type of scan. we see that the brain of the schizophrenia brain is different. Yeah, different. Next slide. So it's proven that it's biological illness. It's not what we say is in your brain. Mental illness is not about in your brain. And 50% chance it could be genetically inherited. It can pass down to next generation. So it's not something that you can control. It's happened in your biological and it happened in your gene. Yeah, it's 50. You can up to 50% is affected by the gene. So you can see that the brain of the schizophrenia, we compare both brain, normal brain and the schizophrenia brain on the normal age, normal background, normal education, normal ethnicity. So we found that the schizophrenia brain the volume is smaller, right? Okay, next slide. Pseudo hallucination is not a true hallucination. It can happen in other disorder, not schizophrenia. Maybe can happen in mood disorders, anxiety disorder, and it can be normal. It can be caused by intense emotion, and the people know that this is not normal. It's not normal. Like the video I show you, the actor Ryan Reynolds was thinking it's part of the life. Yeah, it's part of life. He think that is something is for him is normal, so he talked to the cat and the beheaded head there. So pseudo hallucination is you know that it's not normal. You rejecting it. Yeah, basically. Next slide. So basically, doctor treatment, the fastest and the most convenient treatment is medication, antipsychotic. I can tell you the effectiveness of medication is up to 70%. So if you have seen anyone to do that, please bring them here. And because it's schizophrenia is a brain disorder, it tend to affect his judgment, judgment and his insight. So you wouldn't think that he have illness. Yeah? I can tell you almost 8% 2% tu ada insight sikit. 90+% of the patient who have schizophrenia, they don't think they have illness. Yeah, they think that you have illness, you should be locked up, not me to lock up. So usually wouldn't need admissions unless it's dangerous. Yeah, if every schizophrenia need to put in the hospital, the bed will queue from Shah Alam to KL. Yeah, another one is the most severe term is called electroconvulsive therapy. Yeah, electroconvulsive therapy is actually giving small currents in the brain, but you will be put on sleep, then giving small current and induce a short duration of seizures, mean fit someone. So that also we found that patient can recover faster. Another psychotherapy is not suitable if especially patient are very unwell. Diet nutrition therapy is more on maintenance and helping the upper. So the first one is the main treatment that we use. Next slide. So this will give a very quick understanding about what is depressions and what is bipolar. Bipolar mean bipolar disorders mean they can be depressed 1 or 2 weeks, the next moment normal, the next moment become mania. So depressions, you're not because you're just low mood, we say that you have depression. You must have a series, at least 4 to 5 symptoms. Not only low mood, you lost interest, you low self-esteem, you have low appetite, and then you feeling easily anxious, feeling worthless, then hopeless. Not necessarily you just low mood, you feel sad, that's all. No, you can't find yourself to want to do anything, and there's lots of interest. Yeah, and this must last at least 1 week, 1 or 2 days, 1 or 2 days. Then next day is recover. Mania is also at least 1 to 2 weeks. Then you must be irritable. Wow, imagine you become irritable for 1 or 2 weeks. It's actually when mental illness, when they recover, they're quite suffer. When they can remember what they suffer from this, feeling angry or constantly angry for 1 week. You can imagine. It's quite suffer. And then they have a lot of energy, different from depression. They feel tired all the time. They feel all the energy and they think that they don't need to sleep. They have all the ideas. They can do a lot of things. Yeah. So those people that start to do a lot of things, could be they started to have some early stage, not mild mania, not so bad, The very bad one, they were really bad. I think that they will quarrel with everyone. Yeah, and this type of emotion, that's why I just mentioned to you, intense emotion can cause hallucination. Yeah, but of course this one is not transient. They can be a whole week or 2-3 weeks or months they hear voices. For depression, they usually hear voices that ask him to jump from the height, killing themselves. For mania, tend to hear voices ask him to do something, like start a business, buy some share, or go and make some project. Right. Next slide. So, if it's depression, we tend to give antidepressant. Yeah. There is medication. Yeah, a lot of people. Actually, I can tell you a lot of people don't know there is a medication that treat, and then the effectiveness is also 60 to 70%. So it's very highly effective. So if those who are having mania, bipolar disorder, we must combine antidepressant with antipsychotic or just anticonvulsant. Anticonvulsant is a seizure medicine. Okay, of course, psychotherapy, diet, nutrition also can be useful, but it's not during the severe stage. The severe stage, they not listening to you, so you can't use psychotherapy or diet nutrition that to help them to recover. Next slide. Dementia or Alzheimer's disease, as far as you know, is called Nyanyok, memory loss. Next slide. Okay, this is a natural progress. If you don't do anything, you will go downhill. So it's just from forgetful, just more forgetful than usual, okay? During the time you should have brought to see doctor. So you will slowly go down until you cannot remember your name. You cannot remember, our ex-prime minister, the partner, which is the Kyrie father-in-law, yeah, who have severe dementia, yeah, because this is one of the sad thing actually. With treatment, you can see the green line, yeah. With medication, it can become the green line. You still go down, but not so fast, very much slower, If you go without treatment, you will just go down like that. So if you go earlier, it can stop. Perhaps you wouldn't become like forget your name, forget who are you, cannot forget how to cook, and forget how to drive. No, not until that extent. Until the red color go to the down, the lowest part is you cannot even go to toilet. I mean, you just become like a baby. Yeah, next slide. And of course, we have medicine. It's called anti-dementia medicine. It's only work at the early stage. If already until the stage that cannot remember who are you, cannot remember how to drive, or cannot remember how to cook, that is at least at the stage of severe. It's at the mild or moderate level, anti-dementia medicine will be effective. It will be effective to slow down the progress. Therapy, there is many types of therapies. Usually stimulation therapy. The common one you can play, but of the Sudoku, because most of the research is done in Western, right? But for Malay culture, we play congkak. Play congkak, we use brain, the thing that you use brain, yeah. For Chinese, maybe they play mahjong. Yeah. In Hong Kong or what, they have the research have done that mahjong can improve, especially for the mild dementia. A diet nutrition is definitely for your brain. The diet that good for your brain. For example, that can slow down the progress. Yeah. Also, that is very important because you don't want one day your loved one to forget who are you, isn't it? Next slide. Oh yeah, finish already. Just this is our. I also have invited for some talking about the water. Yeah, just to give some knowledge for you. At least drink 2 to 3 liters a day. Yeah, I think I can say that most of the time, 80% of yours didn't drink that much of water, which is not healthy. It's actually your weight divided by 33. Yeah, divide by 3. That is will be your what you need to drink, how much you need to drink. Yeah, okay, next slide. if you need the link, you can let me know. There's another health talk on online health talk that actually my group of doctors and pharmacists will organize lah. It's talk about heart disease and cholesterol and diabetes. Next slide. That's the link. Yeah, that's the link. If you need the link, oh, that's not the link. That's my personal page. Sorry, that's my personal page, personal YouTube, and personal TikTok. All talk about health. Please share with people because it's all free. So we share and let people know because I mean, a lot of people are not even they are doctor. They're not even a doctor. So even doctor themselves, they are too busy, so they don't do all those things. I mean, most of the doctor don't do all those things. So those are not the doctors. They go and post in YouTube. For example, last time during the COVID, talk about the vaccine, all those things. They spread rumors, and they're not even a doctor, isn't it? Yeah. Because police can't catch and double it. Kantong dia license. Yeah. So we want to spread the correct news, correct knowledge for people. Yeah. Is there any? I think got last slide. Yeah. Oh, yeah. The QR code is the easier one, but you can also get it from the MC, Mr. Hafiz. Next slide. And then, that's my numbers. You can also WhatsApp me. With anything if you need help, you can WhatsApp me. Thanks very much.
All right. Thank you, Doctor, for the very interesting and informative talk and sharing session for this
Thank you.
morning. Hopefully, this presentation will be beneficial for everyone. And I think, do we have any questions from the audience? I don't think so.
I cannot see the audience now. Got audience?
Itulah, that's why. Okay. So we end our session. Can I?
All right, thanks.
Okay, thank you for your attention and Assalamualaikum and very goodbye. Thanks, guys.
Bye.